welcome back. Fighting and beating cancer. Well, we have with us someone here who's done just that, Punita, who had fourth stage breast cancer.
Yeah.
And now you were just telling me there's nothing left.
There's nothing left.
All right, so that story, and actually it was a more chilling story than that, and we'll come to some of the details in just a minute or two. But we're also being joined by Kiran Mazumdar Shaw, the Chairman and MD of Biocon Limited, and also by Arun Bharatram is joining us as well, Chairman SRF, and Mridu Gupta, CEO of CAPED, also with us. Thanks a lot to all of you for joining us. Punita, before I come to your story, Kiran Mazumdar Shaw, just wanted to get your sense though on what is happening in the world when you're looking at the technologies to fight cancer. And over the last couple of weeks, I've been hearing and reading about some of the new work that is being done. More targeted, because essentially at the end of the day, cancer is about genetic mutations. And there are lots of specific mutations that can take place. Increasingly, people are talking about targeted treatment, targeted medication, once the data for that becomes available. Possible immunology, you can do something with the body's own immune system. Would you like to just share some of your thoughts on the technology in this first, before we go any further?
Well, it's becoming increasingly, accepted that cancer is an immunological disorder. So the research on cancer immunology has really thrown up some very, very exciting therapies, which are referred to as targeted therapies, which are really targeting certain immunological factors that have really brought about the cancerous phase of cell development. And therefore, by targeting these rogue factors, you can actually arrest cancer, and now you can cure cancer. There have been some wonderful discoveries made in recent times. PD-1 is one such target. And then, of course, in the past, you've had many other targets, HER2, EGFR, and, many other targets have really helped to improve the outcome of cancer treatment. Now, in addition to that, of course, there are ways of combining immunotherapy and chemotherapy and radiotherapy. And I think the results speak for themselves, because as you've heard from many of the participants in today's program, the outcomes are just getting better and better, and many are being cured. And of course, when you talk about children's cancer and leukemia, you're also talking about bone marrow transplant, which is really a concept of using the body's stem cells to really correct what has gone wrong. And this, of course, is today known to have, known to cure these leukemias, especially in children's cancers. So I think we've come a long way. So and when you talk about gene mutations, yes.
So sorry to interrupt you, just to take that point forward, sometimes we say, let's try and find the cure for cancer. Easier said than done, I guess, because there's no one such thing as one cancer. Cancer, in a sense, is sometimes people say 100, 200 different types of diseases, because it depends on where specifically and what part of the DNA has the mutation come in. Can there be one cure for cancer, or a series of cures for cancer? And again, better database management is one of the things that many international experts are talking about. It then helps us find the specific targeted treatments. If we can coordinate all the databases on this, not just in India, but around the world as well.
Yeah. Absolutely. I think cancer is a very heterogeneous disease. Different types of cancers have to be treated and dealt with differently. But as you very rightly said, it is about cancer management. It's about proper diagnosis. It is about early diagnosis, which is preferable, but many cancers are not really easy to diagnose that early on. So many cancers do get diagnosed at a slightly later stage. But even that now is showing hope of being managed and even cured. I think the biggest problem with cancer is really metastasis. Because as long as you contain the cancer, as long as you localize the cancer, and if you can deal with it in a localized way, then it's almost as good as a cure. But the moment rogue cancer cells escape the localization process, then I think that's where the metastases start. But that's where I think the immune system can kick in and actually prevent metastasis. So that's the exciting research that's going on in cancer today, which is really about dealing with cancer metastasis.
Right, metastasis probably the single...
everything is about understanding the genetics of cancer, the immunology of cancer, both from a diagnostic and treatment point of view.
Kiran Mazumdar Shaw, we were just discussing, you were talking about metastasis just a short while back and why that really is the problem. And I was asking you the question that at the end of the day, the site of the primary tumor is not what kills a lot of people. It's when that cancer spreads through the lymph system to other sites. That's where the deaths actually occur. Is that roughly correct?
Yeah, that's, in a lay speak, I think that's what really kills people. But I think what I was also saying was that today, with the better understanding of cancer genetics, cancer immunology, I think there is a much advanced, access that we have to both diagnosis and treatment. And I think that's what is leading to much better outcomes in cancer. And like many people said on this program before, I think cancer is a disease now which is a manageable disease, a managed disease, and you will not die of cancer, but you will die maybe with cancer. But I'm sure many people would actually be able to overcome cancer. That is the hope that research is giving you today. And I think that's what we should really be looking forward to in terms of supporting, supporting research in cancer. Right. And of course, I think people need to understand what cancer is all about. And I think one of the biggest challenges which you've been talking about is the cost of cancer treatment. Yeah. So whilst all these wonderful advances are there, I think the biggest challenge we have is in making cancer affordable. And that's where I've really focused a lot of my philanthropy, saying how do we make cancer a disease that doesn't daunt you in terms of both the disease itself and the cost of treatment.
So in fact, on that note, Kiran, just wanted to show people some of the work that you've been doing in that, and then I think you wanted to make an announcement. But let's just